During our ministry outreach program, we try to connect the person back within their church community and within the resources available within their community. We find that trying to bridge that gap from their medical home into their home, it gives them a better chance of meeting their needs as far as their medical needs and their health needs.
The best way I can describe it is if something were to happen and you were to lose the ability to do something for yourself, whether it's take yourself to the grocery store, even trying to figure out which medications you're supposed to take in the morning and which ones you're supposed to take at night, who would you go to? Who would be the one to help you with that if you're no longer able to do that for yourself? Unfortunately, a lot of our patients, they don't have an answer to that question. They don't have someone, they don't have a friend or a relative or a neighbor that they trust. So at a primary care physician's office, we're bound by the walls of our clinic, and we can't go to the patient's home to find out why aren't they taking their medication. Well, it's because they're spilling it over the floor because they can't see when they open the bottle. It could be because they don't have a ride to the pharmacy and they don't realize that some pharmacies might deliver, things like that. It's been wonderful to have health ministries to refer patients to that are in that situation. So this has been a wonderful bridge for our patients to get health care that they need, to have someone guide them in what the next step they need to take is to help solve their problem, whatever that problem might be.
Help me with my bills and help me with my financial paperwork and stuff, and help me with taking me to the grocery store and grocery shopping, and just helping me basically with all my bills and stuff like that, and taking my blood pressure, making sure my blood pressure is going down. The home health care that comes out and sees me, that helps me with puts my pills in my containers and stuff. But I just can't figure it out sometimes, If I didn't have her help me, take me to grocery stores and stuff, by the time I get home, my groceries are spoiled, It takes about 3 hours on the bus each way,
One of the tasks I've undertaken is helping with, there's a lady who was needing some help, various assistance, things at home, and I went to visit with her, and I initially did a just kind of an overall assessment of everything and found that she needed some meals. She was lonely and liked to talk, and she also she hadn't been to church in a long time. She had moved over here from Illinois, where she used to go to church all the time, but once she was here, she didn't have a way to get there, didn't know a church to go to. So our church reached out to her and took meals to her because she couldn't stand long enough to cook and she couldn't clean her house. And so the church just jumped in, I sent out word and volunteers jumped in and helped with that. And we even found some people that would drive her to church so she could get there on Sundays. And she was just overwhelmed and happy that all that could be done for her. And so that's just a way that the church can jump in with the health ministry. You don't have to be a nurse or something like that to help with the different tasks that we undertake.